if you try and hide away, block a traumatic episode, then you may be fine. You may forget about it. It's great, but there's the risk that if you haven't processed it, it'll come to the front of your consciousness and
Absolutely.
whack you like a big polar bear sometimes.
And don't we all do that, right? Don't we all, like, I don't have time to deal with this. I'll deal with it later. And then we never do. And it just sits in there and festers until we're like, I don't know why I'm yelling at you. I'm just yelling. Or I don't know why I'm flinching. And it comes out in these really funky ways because we've just gone, I don't have time for that. I'll deal with it later. And later never comes.
So in your opinion then, did I deal with it? Was it dealt with at the time?
My personal opinion is no.
Right.
There are some therapists that would say, yes, like if we can contain it and you can manage it, absolutely. But my personal opinion is if we can get it cleared out and make it easier so you don't have to flinch all the time, well, that seems like that's a better deal.
Well, that's only happened recently. I mean, at the end, whilst I was going through all of that, there was no question it was cleared out because, I mean, that led to a number of great big crashes in the sprints at the end of races because I had no fear and was prepared to push it that extra. Well, you're supposed to push it that extra bit, but I was pushing it an extra lot at times, and that caused a number of big crashes.
So that's a little different. You might have processed a lot of it, and there was just a lingering piece that neither you nor the person you were working with noticed.
Right.
So we do our best to clean it out, but I can't tell the future. And sometimes something you don't expect pulls it back up again. Who knows what? It could be something benign, seemingly benign, or something pretty obvious.
Okay.
And then sometimes you just need to go clean up the pieces a little.
So where does the eye movement come in?
So eye movement was the original research that was done. And then when we found, wait a minute, all these other bilaterals do the same thing. So it's named after the eye movement. I almost exclusively used eye movement until I went electronic and COVID was forced when we all shut down. And people said, hey, let's do this telehealth. And I was like, I don't know if this is going to work. It worked pretty well. And I was like, okay, that's cool. Let's keep doing it.